We are 80-year rich health plan here in New York City. We service all lines of business, but specifically we are in the Medicaid and the state kind of sponsored program space, all the government programs, Medicare, Essential Plan, really looking to serve our underserved communities. We are really huge in the community. So we have brick and mortar, I want to call them brick and mortar areas or community centers where we service anybody who, agnostic of plan, can come in and they can get their social needs met. They can be linked to any type of provider, whether it be primary care or behavioral health care. So we learned about Unite Us through the Social Care Network and the 1115 waiver that came through. And so it was really interesting to understand how Unite Us was not only a connector for CBOs where they could not only put information like their payer, billing, claims, but also it could be an EMR for them and a referral connector. So we found that to be really interesting just because when you look at a lot of, I want to say, platforms out there, they don't have all those little connection points. They do one or the other. So to see something that you can gather patient information, have assessment data in there, also be able to connect it to claims and billing data and kind of give you a full picture of a member was very interesting. I think when it comes to social care delivery, what's really interesting is that Medicaid at its core is almost like a social government program, but yet it doesn't really have social benefits in the benefit structure. So it makes it really difficult to understand how do you incorporate a primary care, behavioral health care into this social care structure. So I think that's what we're kind of focused on is how do we make sure that we give you the best health outcomes from your primary perspective, your behavioral health perspective, but then we integrate that with kind of like the social care needs. So I always think about it like Maslow's hierarchy, right? And so if you don't get your social needs done first, then you can't work on anything else. So to me, I think that's the beginning of everything. But from a plan perspective, it's not normally where you work from, right? So I think what's really good about this is that we have these neighborhood care centers at Emblem Health. So what we can do is we can use that to kind of bridge and integrate the gap that we're seeing between social and primary care. So I think the barriers is definitely going to be things like making sure that we have our claiming and billing systems up to date, right? And be able to work in a way that works for a CBO. Because right now, everything is kind of very easy for primary care. They send in a claim, they pay, and that's it. A CBO, especially when they're smaller CBO shops where they don't have that type of infrastructure, there's a lot of education that's needed. So I think it's how can we be a collaborative partner with them so that we can help kind of educate them on what a plan needs so that they can get what they need as far as funding. But then also, how can we help them get information that they need about members, right? Because one of the unique things is as a plan, we have a lot of data about the member. What we miss is that community component. So how do we bridge the gap between the two? So I think it's working through kind of that type of barrier. And honestly, I think it's just communicating on, like if you being with the SCNs, understanding what their concerns are, having them understand what our concerns are, and then finding a way to get through it together. I think because of the uniqueness of Unite Us and just how it pulls together all the member information, I would love Unite Us to work with payers to help us have sustainability in the social care kind of network program. So I could see Unite Us being that gap where we can make sure that all the social data that we're getting gets to the other kind of primary care data that we're having, hospital claim data, all that stuff together. So I can definitely see that being a connector for Unite Us.